Is that okay?
Yes. Yes.
So what we're going to do is continue on that learning and then go to today the learning outcome 3, which talks about, to understand what is healthcare provisioning. Who, how do you provision, what is the provisioning of healthcare in terms of, who all can get those services, what are those services comprising of, how the policy, which is formed in the learning outcome 1, when we looked at, okay, the NHS, it's good to know that the NHS is the National Health Service in UK. It provides all these services, but now we need to see is how the nitty-gritty of that policy actually makes these services available, which the policy is made by the government. And once the policy has been made, the NHS Act comes into place. The services are divided, the infrastructure is made available. But how does the actual flow of services, happen to patients, customers, or citizens in the UK, is what we will look at. That would mean, we're looking at understanding how policy is translated into action, or into meaningful steps which actually provide the services required, like healthcare, nursing care, for example, or the mental health care, things like that. We will understand. We'll also look at how the provisioning of policy happens at the international level. What is the role UN plays, United Nations plays? What is the role World Health Organization plays, WHO? So we look at some of the international bodies which implement the policy agenda of having healthcare policy globally into working with regional governments, or basically countries governments, to be able to implement this policy at the local level. And then what we will look at is we will also understand what are the barriers which do not which prevent this policy to be implemented in certain areas. So you could look at disasters that we will discuss in terms of the current disaster of Irma, the Hurricane Irma, and Hurricane Maria, which has affected the Caribbean and the US states of Texas and Florida. We will look at these examples to understand what kind of a response sometimes the government at the national and international level have to put together to be able to meet these provisions in the case of such situations of emergency situations, and what are the barriers they have in terms of, for example, Hurricane Irma has devastated a lot of countries in the Caribbean. There's no food, there's no water, no electricity at this moment. So what are the barriers? The barriers are obviously we understand. So we'll discuss that in a bit more detail towards the end of this learning outcome. Now, so looking at what is the role of government in terms of provisioning of healthcare. So what does the government essentially do? I think what we have covered in the first outcome, just stretching that a bit further, is the government basically creates law and legislation. So what they do is they create a law, or they created a law post the World War II era, saying that, okay, the health services in UK will be provided by the state, and these health services will constitute not just care in terms of just the basic healthcare services, but will also include specialist services and treatments and other bits and pieces which are required from time to time when people are diagnosed with different types of or they require different types of treatments. So they created a comprehensive healthcare policy, and that is what the role of the government is. That it cannot say that you can only get a certain amount of prescriptions from the GP surgeries. But if the GP surgery cannot provide you the service, then you have to be referred to a hospital. And in some cases, you have to be referred to a specialist or a consultant, which will then help diagnose the problem, and then, appropriate services will be provided. So it basically creates the law and legislation. Now, the other bit that they have also done over the years is, as the NHS has evolved, is they've created the Nhs Constitution, they've created the Healthcare Act in 2009, and they've also looked at then structuring the services into different types, as we discussed earlier, primary, secondary, and tertiary. Primary is, at the surgeries, secondaries at the hospitals, tertiaries when you receive specialist care, for example, care homes and, nursing homes, cancer treatment. Those are the bits that they have put into place. Now, who is covered? So in the NHS, everybody is covered as long as they have a legal right to remain in the UK. They are citizens of UK. They are born, and obviously bred here. So they have, a right, as long as you're considered a term which is called ordinarily resident in the UK. That means you have a British passport or nationality and you are basically a resident of UK, then you are automatically entitled to receive this health care from the NHS. Now, in some cases, when you have the current discussion of Brexit, which is happening, as you can see, there is a lot of discussion and negotiation happening because there are about 1.3 million, Britishers or people who are residents of UK, nationals of UK, are actually living in Europe, and there are about 3 million Europeans who are living in the UK. Now, the key concept is that currently, because they are covered under the European Act, the Health Insurance Act, NHS does provide them, services free of cost. But what will be the arrangement after Britain leaves the EU will have to be renegotiated. So that is what the current mode of discussion is. But in general, as of now, anybody who is who's basically a European citizen of the 27 countries, if they come to the UK, they are entitled to receive the service if they fall ill or they have to undergo some sort of a treatment or seek medicines from GPs or things like that. They have to produce a card which is called the European Health Insurance Card, EHIC card. And this card is also something which a lot of us have. I don't know whether you have this card, but a lot of residents in the UK, when we go on holidays to Europe or when you travel, we carry this card with us so that at any given point in time, we can produce this card into a relevant place in a country, and that would mean that we will get the health services free of charge. So from that perspective, when you look at emergency treatments or when you are out and about or you're traveling and you're in different countries, there's a treaty which exists, and that would essentially mean that we are covered in Europe and European citizens are covered here. But ordinarily, the National Health Service supports, at the frontline operations is to support anybody who's residents in the, in the UK and have been a UK national will receive this service free of cost. Now, apart from that, what we also look at is we also look at what is covered. Now, sometimes when you have people with different nationality, different status, you have somebody who has got the international, say, indefinite leave to remain, somebody who's a British national or has been naturalized. Sometimes you will see European nationals in the UK receiving treatment. Now, the type of treatment they receive could vary under the arrangements which are there. So in some cases, when we travel to Europe, we are able to go to a surgery and ask for, prescriptions and things like that, which are considered okay because that covers us under the EHIC scheme, the European Health Card Insurance Scheme, and vice versa for European nationals in the UK. But if you have to be looking at treatment which are going beyond the primary sets of services, which is beyond GP surgeries, then in those cases you might need specific permissions, or you will need to provide documentation which clearly establishes that you are resident in the UK for so many years, and under that provision then only you will receive that treatment. So things like vaccinations, things like clinical treatment, when you look at treatment which are to do with bits and pieces related to long-term rehabilitation, which is like physiotherapy and things, are only available to certain under certain circumstances if you are not a UK national or a UK resident. So the National Service primarily is created and provides services to nationals of UK or people who are considered resident in the UK are the ones which will primarily receive that service. So if you have some visitors which come across from, say, abroad, and they need to see a GP, then in that case they can go and see the GP, but they will have to in some cases pay for the prescription or the services that they have been looking at. Like I think in 2015 the UK BA or the United Kingdom Border Agency actually introduced a scheme wherein students who are studying here under Tier 4 visa will only be able to access the NHS service if they have paid for the NHS service charge. And that is what something which was introduced, as a process of, changes being brought into to accommodate people from overseas who would need the service on a cost-to-cost basis. So in some cases, some of these services are provided, on a cost-sharing or out-of-spending basis. That means you have to pay for the cost of prescription. Like in Wales, and in Scotland, there is no prescription cost. It is absolutely free. The prescription is given by the GP free. But when you look at UK, in general, England and Wales and Northern Ireland, there is a cost of prescription that you have to pay. But in Scotland, it's absolutely free. So in some cases, when you look at, there are some parts of the service which you have to pay for, like the dentist services. When you look at, that kids will receive this treatment up to the age of 16 free. But after that, the services are paid for. And that is where you'll have to make payments to be able to get some of those services which are defined under the NHS as services which are requiring out-of-pocket spending or require cost sharing in terms of, making those services available. Is that something that you've seen?
Yeah.
Okay. So dentists, for example, everybody is aware, dental surgeries are all subsidized, or, they work with the NHS. But when you go to see a dentist as an adult, you have to pay for their services. But kids up to the age of 16 are absolutely seen free. But some of them, if you require specialist treatments, then in those cases, there will be a minimal charge. Even if it is a child, they will charge to be able to cover the cost of that particular treatment. So if you go in and you say, okay, I want to get a tooth removed, that there might be some sort of a charge that they will ask you to do or pay, and that would come under something called cost sharing. Is that okay?
Yes.
Now, the government also created in their policy, when we look at healthcare provision, they created something called a safety net. A safety net was a net for people in the sense of provision created for people wherein if they are under a certain age or over a certain age and are declared as a pensioner or as retired, then in those cases, they will be able to get, what you call services absolutely free of charge. So in those cases, the charges are waived off. So for example, when you look at children under the age of 16, and or in full-time education between 16 to 18, and people who are older than the age of 62, or in this case, the retirement age, then in that case, what they have is the services are given free of cost. So sometimes you also get to see that if you're, when we see ladies, or when we see, women when they are pregnant, some of the services under the pregnancy cover are given free of cost. And in those cases, what happens is you get issued a card, which most women get, which is a pregnancy card, which the GP surgery issues, because you have to undergo a lot of treatment checks and other bits and pieces. Then in those cases, those services are offered absolutely free of cost. So in those cases, if you develop a condition on the tooth, or you have to see a dentist or something like that, then even those services are given out, free of charge under the NHS. Is that something that you've seen, or you've heard? Is that, yeah?
Yeah.
Okay.
Very familiar.
So in those cases, when I know say for example, when my wife was pregnant, and obviously I was having we were having the first child. Some of those things, like when she had to prescribe for a medicine, or things like that, there was no prescription charge. So in those cases, that is where the meaning of the safety net comes in, is that in those circumstances, when you are the government has created the policy and legislation in which, in those circumstances wherein you are undergoing a specific, you are under a particular age or over a particular age, and you have a specific, situation like pregnant women, then in those cases, what happens is you do not have to pay, for these services. Now, in other cases, when we look at, we discussed last time that how is the funding done for the NHS. So the funding of the NHS, not only comes from the government fund, the King's Fund, the Prince's Trust, but it also gets direct fund in terms of contributions coming in from your national insurance. So in most cases, when we look at, in terms of how the system is financed, is that there is a set specific budget which the government keeps aside, and this budget is then made available to the CQC, the PCTT, and the various trusts which are created which run all these facilities and services. And their key role is to utilize this funding in making these services available at the front line. That means people, when I fall ill and I have to go to the GP surgery should be very well funded to be able to have the necessary funds available to be able to give services of the doctor being able to see the patient, being able to prescribe the medicine. If you are over 60, then the prescription is free. Like the winters are coming, so in some cases, children under the age of 7 or people over the age of 65 will get a free flu jab injection. And that cost, or those inventory, which is in terms of the jabs, is already made available to the surgery. And that is where the financing of the healthcare system comes in, wherein the government has to ensure that it has adequate funds available for them to be able to provide to all the various structure and mechanism of running the national service, so that at any given point in time, it should not be that there is no fund or, restriction on the spending and things like that. So last that we looked at, about 10% of the GDP of the government is actually spent on national health services. And this is then broken down into, various services which are provided. And some part of it is topped up by cost sharing, co-sharing, or, in some cases wherein you have to pay for prescriptions. So all those expenses and other bits and pieces that you contribute actually then top up the budget of how the NHS is actually funded. Now, you also look at, in some cases, the government has done, there is a term that we will use time and again in some of the units that we will now study, will be public-private partnership. This is a term which will come across in another unit called 7.8, and there is a direct one or two, tasks related to the assignment. Now, the government, in order to make sure that there is adequate funding available and all the types of services are provided, the government has also created a provision under the NHS Act, is that they have created some services which require public-private partnership. And that would mean that in some cases, some of these services, like the specialist services, when you look at cancer, for example, the Christie's Hospital, some of these services have been privately financed, wherein the government also contributes to a certain extent funding for these services when they are given out to ordinary residents in the UK. So most private expenditure is in the case of, when we spend money and when we say we need to go out and get a prescription, we spend money in terms of getting the prescription or paying for the prescription. In some cases, what you look at is if you pay 720 or 780 as the cost of prescription, you see the drug is cheaper, you might go over the counter and buy it. But in most cases, if the cost of the drugs buying is higher than the cost of the prescription, what you will do is you'll go to the GP surgery and say, okay, prescribe it, and then you will basically end up getting the prescription. So in those cases, when you look at there are private hospitals which are also set up, and the NHS, government and the NHS provision has made clear that if you choose to have private healthcare, like a lot of people have healthcare insurance. So in terms cases, there are some treatments they would want to get it done privately. So they take out a healthcare insurance. So that provision has also been created in the NHS, wherein you can take out an insurance policy, or if you have the means and the remit, then you can also access what you call private healthcare in the UK. And this is normally done, when you look at countries like US, which have followed suit, like the UK, to create a healthcare system, which is the Obamacare, and they're still kind of, trying to fine tune it. But the whole idea of creating Obamacare was that they wanted to make the basic healthcare facilities available to each and everyone in the US who is a citizen of US. And that is where, in some cases, before this it was introduced, when you look at it, it was private healthcare. That means if you had, if you required if you had a medical condition or you had to get operated and things like that, you had to pay for it privately in the US. But in the UK, the government has created a system wherein you can have both the state use the NHS as the service, but if you want to top it up, you can also have private healthcare, and you can make use of going to a private hospital, pay for the prescription, and getting procedures or treatment done. Mm-hmm. Now, how is the delivery organized? Now, delivery, as this was something that we looked at again, but when you look at provision, the delivery is, if you recall, one of the organization charts when we looked at, and the number of people working within NHS, roughly about 140,000 people work within the NHS, which are a combination of doctors, nurses, the ancillary support staff. And here, what we get a sense of idea in this particular slide is, when you look at primary care is provided through, GPs or GP surgeries. And there are some 40,000 GP surgeries in UK or in Great Britain in general. And out of that, there are some surgeries which basically, on an average, if you look at, have about 7,000 patients, 7 to 8,000 patients, across, what you call the 8,000 surgeries. And within those surgeries, you have about 40,000 odd doctors which work as GPs. So essentially what you're looking at is, at some stage, there is a clear indication of you having an understanding of how the system works. So you have GP surgeries, you have hospitals, you have consultants, you have nurses, and you have all the other staff which actually supports this whole system in terms of providing the service. So if you fall ill, or if your child falls ill, what do? What is the first step that you take?
Call the ambulance.
If it's serious, for example, if it's very, very serious, then obviously, yes, you call, the emergency number and call the ambulance. But if it's a condition like you've had a fever or a sore throat, or, you've not been well because of, some reason, like you're under the weather and things like that, you normally go and see your GP or seek an appointment with the GP. And that is where the whole provision of healthcare actually starts to come out. So when we say frontline services in the National Health Service, frontline services are provided by GPs, by GPs. You know, they are the first person that you go and see. So, for example, if I develop, you know, if in some cases what you tend to see is you've had a severe, you know, fever, and the fever is not going down. So you go and see the GP recommends some medicine, you take that, but if it's not improving, then the GP then refers you to a hospital. And in the hospital, you will probably end up seeing a consultant. And they diagnose, okay, you've not had a normal fever, you've had probably a jaundice or a yellow fever or a different type of fever, which requires different treatment, and that treatment is required within the hospital. So the frontline services that we receive in terms of healthcare, where do they start? With the GP surgeries or GP practice. So in most cases, when you see, you know, the breakup of staff, we have about 66% of the staff which actually works, and most of the services are provided through the GP surgeries. And beyond that, the balance 60-40 split. So the 40% of the split is normally specialized services, which then are provided through the hospitals. Now, there are some other services which are also, you know, provisioned in the Healthcare Act. And those services are mental health services, you know, your nursing home services. You look at specialist services which are required in the case of, you know, say, for example, cancer treatment, bowel cancer treatment, you know, those kind of things. And those services, in some cases, are part funded and part, you know, you have to pay for. So if you're receiving a specialist care, for example, you've undergone a clinical procedure, you've had the operation, you've been successful, you've been discharged from the hospital, but in order to get back into mainstream, sometimes you require physiotherapy sessions, sometimes you require counseling, sometimes you require care which is to be done at the place of work or at the place of, you know, where you live. And that care is then specialist care, which is a nurse coming to, you know, see you or, you know, look at providing you some services which are basic services to help you do your course, are basically then, in some cases are free, but in some cases they are chargeable. And those specialist care, for example, when I look at, with an example, when you look at pregnancy, those services are absolutely free. So the nurse will still come and see you, or the midwife will still come and see you at the home, but that is not charged. But if you had a procedure, maybe say, for example, you had an accident and you undergone a fracture and then it's been operated, but when you come back home, you need to receive physiotherapy sessions. So in those cases, some of those sessions could be part paid for or costed, and those are what we call is specialist care. And those specialist care, you know, services are actually provided outside the hospital or outside of GP surgeries. And I think in most cases, it will be fair to say that they are provided within the confines of your home, isn't it?
Yes.
After the pregnancy, for example, most you know, ladies would receive some sort of, you know, attention in terms of midwife visiting her, or, you know, coming in to just check on the baby and things like that. But that happens at the confines of your home, isn't it? It doesn't happen in the hospital. So if you had an accident and you require some physiotherapy sessions, that might not happen in your home, but you might have to go and see a physiotherapist or a clinic, specialist clinic, or a specialist center wherein those sessions will then be organized for you, isn't it? So
Yes.
that is the provision which also is there in the NHS, wherein in those cases when you have to receive specialist care, it can also be provided at your home, at the place of work, or at a third party place, which is then partly financed, or in some cases absolutely free, but there is a provision for that as well. Okay. Now the other provision that we understand when we look at secondary care, the secondary care provision that we look at is primarily hospitals, and these hospitals are all publicly owned. There is no in the NHS, when we say the trust is running the hospital, is mostly publicly owned. That means it's owned by the government, funded by the government, and it is normally under a, you know, primary care trust, or PCCT as we call it, and they would then run it, monitor it, and the Quality Care Commission, CQC, will actually do inspections in order to ensure that the standards set in the policy provision are being enacted out when the services are provided to the patient. Correct? So in this case, when we look at the secondary care, we start off with hospitals, and roughly about, you know, there are about 147 such, you know, trusts which maintain these hospitals within different, you know, regions within England and Wales, Scotland and Northern Ireland. Now, in addition to that, in the UK, we have about 548 private hospitals, and there are some 500 to 600 private clinics for people who are part and registered with the British Medical Association, but they do private practice. So as a doctor, as a GP, you might work with the you know, NHS, but you might also have your private practice, or you might also be working in a private practice. So when you look at certain categories wherein you look at, say, for example, a hair care center. A lot of people are now going bald, and what they do is they basically seek. There is no provision for such service within the NHS. If you have to get hair transplant done or things like that, you have to pay for it. So what people will then do is the NHS will, instead of doing the treatments internally, they will say, okay, why don't you go to specialist care and get that care done from there. So if you're looking at hair transplant, you might go to a Belgravia hair care center in London, for example, which is very well known. They advertise on the TV, and that is where you're paying privately for the treatment to get hair transplant done, isn't it? So sometimes what you do is you seek out these treatments. In the case of women, for example, they do a breast implant, and those are things which NHS does not subsidize. But in those cases, you have to go out and get specialist care. Or, if you look at plastic surgeons, for example, if you're not happy with something, then, people get plastic surgery done. Now, those are provisions or type of treatments which NHS allows you to receive privately. And that have to be 100% paid for by the individual, because this is not considered as primary healthcare or providing primary healthcare. Is that okay?
Yeah.
Do you see the difference? So there are publicly funded hospitals and services which NHS provides, but apart from that, you have services which NHS allows you to receive from outside, which is primarily private service, service, and that is given out through the private hospitals, and there are about 550 in the UK, and there are about 500 to 600 clinics which provide specialist care, wherein you can pay for the treatment and receive the treatment without having any waiting times or any interruptions from the NHS. And they include things like, when you look at cosmetic surgery, bariatric surgery, fertility treatment, things like that are provisions that you normally go for when you look at private treatment. Is that okay?
Yeah.
Now,
the NHS pays plastic surgery, isn't it?
Well, in some cases, if it is, because of, say, for example, I'm just making this up. I'm just making this up. I'm not, like, we had the Grenfell Tower tragedy which has happened in London, right? In those cases, if people have severe, had severe burns because when they were trying to escape, and this was within the publicly held building, the council estate. So in those cases, the NHS will either facilitate within their own provision plastic surgery or recovery surgery for the patients who have suffered burns, or in those cases they will subsidize. That means they will say you get the treatment done, because you cannot wait for the treatment to happen within the NHS. They will say, okay, we'll pay this private provider, which is an approved contractor, and through which you can get the services done, and the NHS pays for it directly. Like in the news, it's a good question you ask. Yeah, they pay for it.
Like, for example, if I want to do like bypass to lose weight, and NHS, it's long way. I mean, it's long waiting list. But then if I say like transfer me to private, because private is more quicker. No, there is no waiting list long. Like, and I still I have to pay for myself, innit? NHS never pays like this kind of plastic surgery. Well, this is what is called liposuction. So, for example, this is an example that we are discussing, has no bearing with obviously the course, but just as an example, if you look at if as a condition, obesity, for example, you're overweight and it threatens your life, and obviously it is a condition which is leading to a threat to your life, then in those cases, if the NHS has a long waiting list or time in terms of wait times, they will probably pay for this service and say, okay, you need to get it done, and this is the recommended list of hospitals that you can go to, and they will do this procedure of liposuction, which is the removal of excess fat across your organs and stuff to help reduce weight. Now, in some cases, NHS will also undertake surgery for certain types of conditions, wherein they will put a ring or a band around your stomach to make your when you have bulimia, for example, the disorder of eating too much. So wherein they will put so they will do those kind of specialist treatments will be subsidized by NHS. So if you look at the recent news, wherein the recent news was the French company which did the PIP implants for breast implants, PIP, and they were found to be faulty. So the court has been ordered, the European court has ordered the company to pay for those implants, but the NHS has come forth and they have said that some 40,000 British women were also affected by that. They had PIP implants, and what they said is, in order for them to not wait,
because it is going to, it can lead to cancer and cancer-related conditions. What they said is that in those cases, the women can choose, speak to NHS, the respective, and if there is long waiting time, they can get this procedure done externally with a private hospital, and that will be paid for by the NHS.
Okay.
So in those cases, those are conditions or, situations in which the NHS either looks at subsidizing or even pays for the primary care, because they do feel that this is something which is life-threatening and needs to be looked at from a point of view of, immediate rectification. Now, the other services that we look at, like the Mental Care Act. Now, we all think of services under the NHS as the health service, for example, which is for clinical procedures and, basic things related to diseases, medicines, conditions or whatever. But there are other services which NHS also has, and because we are all living longer, and obviously because of us living longer, there are other types of conditions which are being currently diagnosed. So we think of the National Health Service to only look at conditions that we are aware of. But there are lots of other things which are coming up in the future, because we are all living longer, new types of diseases, new types of conditions being diagnosed. So the NHS has also created provisions for something called, other ancillary services which are to be offered to the patient. And one such service is called the Mental Health Care Service. So this is also an integral part. Within the NHS, there's a set specific budget which is prescribed, and it is differentiated from the budget for other services like the clinical care services provided. And this is also funded absolutely free. It is funded by the government. It is free of, these kind of services are provided free of cost to, obviously residents or people who have nationality within the UK. Now, these are less serious conditions or less serious illnesses which are considered. For example, you have anxiety, you have mild depression, you have disorders which lead to, fits and things like that. But they are also conditions which NHS, has provision for, and they are covered under the Mental Health Care Act, which are considered wherein you can receive treatments for these from, NHS related, outlets, which could be hospitals, GP surgeries, or, certain specialist care trusts which have been created wherein you could be referred to receive this service. And in some cases, you also have, community-based service. For example, if you've had, adverse effect of drugs, for example, if you were a drug addict, they brought you into a rehabilitation program, you've recovered, but you've recovered, you've had symptoms in terms of recovery, which has created mental health care issues, then those are then also services which the NHS has provision for and are provided. But in those cases, the services do not require any prescription of drug or treatment, but they require services in terms of care. And those care services are provided by, companionship, care, somebody coming in to look after you, see that you are not going back into, the same thing. And those are then provided through, community-based staffs or, the triage team, for example. When you look at pregnancy care, the triage team actually comes into play. So similar services are also in play when we look at, mental health care services. Now, there is also support for something called long-term and social care services support. So, for example, when you look at people who do not earn the national minimum wage, say, for example, their combined income in the household is less than, for example, £18,000 or less than £16,000, then in those cases, those people are exempt for paying for some of those services. So when you go and take a prescription, in some cases, when you go to the pharmacist, they will ask you to, tick one of the categories. So are you under 16? Are you retired? Are you Defence Forces member? Things like that. So those are, categories which the NHS has also created, and the policy has also created wherein you could have reduced payments. If, for example, you're a job seeker allowance or you're not employed at this moment, then in those cases, you're exempt from those prescription services or payment for those prescription services. And if you do require care, which may be because of some conditions or illness or whatever, then in those cases, that level of care is also provided to you free of cost, and you are prioritized. So, for example, if you are, say, for example, if you lost your job and you have no livelihood in terms of income, and you have children, and if you go to the council, they prioritize you in terms of making sure that you are on the top order of getting a house from the council or getting a place from the council to live. So, similarly, healthcare services are also prioritized depending on how much you earn or how much is the combined income coming into the family, and they follow something which is a scale which has been set by which keeps changing according to the conditions in terms of national minimum wage. But there is a framework which is available, which is set by one of the bodies within the NHS, and that allows for the care to be prioritized to those individuals which are in need of that care because of circumstances they are in. And that is also essentially covered within the services. Now, when we know, this is something that we've looked at, but just a summary slide here. So what do we know? How does somebody receive healthcare in the UK? Now we know that NHS gives you, but there are 4 key pillars of NHS which actually give you this care. So one is, we looked at the Department of Health and the Secretary of Health, which basically looks after setting the policy and the framework. After that, we have seen the creation of the Nhs Constitution and the Health and Social Care Act of 2009, and then Health and Social Care Act of 2012, which actually provisions for this service, budgets for it, and the government has enough funds and makes the funds available for providing these services. And then we looked at 2 other places, 2 other things which we talked about. One is NICE, the National Institute of Health and Clinical Excellence, and then we looked at NIHR, which is the National Institute of Healthcare Research, wherein the government also spends a lot of money and keeps a bit of budget aside from the NHS budget to do research and development for the creation of new drugs or diagnosis of treatments for newer illnesses which are being currently diagnosed as we go along. And those are bits and pieces of the 4 pillars of national health service, through which everything is set. So you have the NHS Constitution, the NHS Act, the Health and Social Care Act, which is pillar 1. Then you have NICE, National Institute of Health and Clinical Excellence. You have NIHR, which is the National Institute of Healthcare Research, which basically does research and development. And then you have the CQC, which is a body, which is the 4th pillar, which actually maintains the framework, does audits, does checks, penalizes, and also looks at penalties and legal challenges in case if they find the services do begin to slip in some of the cases when they are provided through hospitals, the trusts, and the surgeries. Is that okay?
Yeah.
So basically what we look at is, when we look at, now there are some other bodies which have also got created over the years. Now there is something called the King's Fund. And I'll send you a small article on the King's Fund. The King's Fund is an independent body which receives some funding from the government, but also receives funding from other places, which basically say coming in from national insurance contributions, private donors, and things like that. But that body basically works in tandem with the NHS Act to create policies which benefit the individuals getting those services. There are some surveys which the NHS also does, but they might not do these surveys internally, but they've created or contracted external contractors which provide these services. So when you receive a clinical care, you're asked to fill in a feedback form, right? You've undergone a procedure, for example, and they ask you to do a small feedback in terms of how was the services, was the GP okay, was the surgery okay, did you get the care that you needed, and will it help you in recovering, as described by the consultant. So when you do these surveys, when you do this, feedback, this is important because this is captured by, external contractors like the Healthcare Watch body, which is basically a body in England, which looks at, getting feedback and opinion from patients who have received these services, and then it feeds back into the system to make sure that some of the drawbacks, some of the negatives are ironed out and removed from the system. So there are a lot of other supporting bodies which work with the NHS, but they are kind of external, is because they are contractors to NHS or National Health Service, and they primarily help run the service. So it could be things like an IT contractor. The NHS has a lot of IT contractors or IT companies which help maintain the NHS IT infrastructure. Would you agree with that?
Yeah.
Yeah. So this is one such body which works externally. They do not work directly to provide the care, but if they do not provide basic care in terms of keeping the hardware up and running, or when you look at all the clinical equipment that is used in surgery and other bits and pieces, there is an external contractor which actually maintains all that. So when the purchases have to be done, so they are a part and parcel of the NHS. But if they do not provide the service, or they do not do maintenance across the year of these beds and equipment and monitors and all those things, then the service standards could deteriorate. This NHS would not be able to, or doctors will not be able to use the equipment and not be able to provide the right service. So those are external, contractors, but they are also a part and parcel of what we call is the NHS, right?
Mm-hmm.
Give me 1 second. Hello. Hello. Yes. I'll have to be slightly quick because I'm teaching at the moment. Yes, go ahead. Yeah, in about 15 minutes, if that's okay. Yeah. Thank you, Kevin. Thank you. Bye. Sorry about that. So what we are now looking at is, maybe in the next 1 or 2 slides, what we want to be able to look at is how does NHS maintain the care? Now, having a policy, having a manual, having the book saying that we do this, we do that is fine. But who enforces essentially this particular care, that the book is being followed, the procedure is being followed? And that is one of the most important pillars of NHS, called the Care Quality Commission, CQC. Now, they have the responsibility to maintain, update, and kind of go and audit the implementation of all the regulation which is required to run these services the way it has been described in the NHS Constitution or in the Healthcare Act. Okay. Now, they work with all the providers, whether it's surgeries, primary, secondary care, tertiary care, whether it's external contractors. They work with everybody and they audit everybody. So they are the prima facie body which is responsible for ensuring that the Department of Health and the NHS Act which has been created, which says you need to provide this kind of service, they need to ensure that this service is actually being provided. So they are the auditors, they are the checkers who basically go in and check everything and make sure that everything is being delivered as per what has been described in the manual. Is that okay?
Yeah.
Now, one of the other things that we also look at is what is currently done, because as you know, NHS has lots of things, lots of different types of services. Sometimes I'm not aware as a patient that this is something that I can go to see a GP for, or go to see a doctor and then get some advice or prescription from it. Now, from time to time, what you will see is that what most GP surgeries or practices do is that they also do a lot of promotions, which is in terms of not promotions like promotions which are sales promotions in the terms of awareness campaigns or awareness programs, to make sure that the patients which are registered with that surgery or with that particular hospital are aware of the full set of services which the surgery or the hospital actually provides. Sometimes, have you seen, sometimes if you're registered with a particular surgery or practice, in London, you would have seen that from time to time they put out a banner saying accepting new patients.
Oh, yeah. Even here in Northampton. Yeah, in Northampton as well, yeah.
Are you there, Aman? Have you seen that?
Yeah, in Northampton. In Northampton
sometimes
as well,
you get to see that GP surgeries put out a banner or a notice saying that, that we are accepting new patients.
New patients, yeah. They do here as
those
well.
are, reasons why sometimes they will do promotions or awareness campaigns to be able to make, in general, patients aware that, this is, there's a surgery in your local area, and obviously the surgery is accepting new patients. And, in this case, if you're a resident of this particular area, then you can come in and register with them. So some of them, in order to make sure the CQC, what it does is, in order to make sure that the GP surgeries practices provide the services to the required level, there are some incentives sometimes CQC also puts in place to ensure that these financial incentives motivate and drive the GPs working and the staff working within those surgeries to provide the services, to be able to provide them as per what has been defined in the framework. So here, basically, CQC does two things. They do a policing act, but also at the same point in time, they do give financial incentives to, in terms of maintaining those frontline services at an agreeable level, so that they, at some point in time, when they go and monitor, they ensure that, if you're doing the things well, they will financially incentivize you to be able to continue to provide those services at that level. Now, one of the last few bits and pieces of things that we look at is that there is something called the Better Care Fund, BCF, which the government has also created, in 2013. And this fund basically has budget which the government provides to this particular fund to take care of any other local, provisioning for projects which are working within the NHS, which are, for example, working on new innovative techniques to provide healthcare, social care, and those bits and pieces which are not provisioned in the Mental Care Act, the National Health Service Act, are actually, or the Health and Social Care Act of 2010, or 2012, have been actually provisioned in something called the BCF, the Better Care Fund. So any other new form of service which NHS needs to provide or may need to provide because of the requirement for that coming in actually is funded through the BCF. And there is a set specific budget which the government has created. And at any given point in time, it is working with the NIHR to be able to make sure that research and development is happening for, new drugs, for research and development is happening for diagnosing new, treatments for illnesses, or, for example, in this case, the modern day illnesses that we look at, things like obesity, Alzheimer's disease, cancer, for example, and those are then partly funded through the BCF or the Better Care Fund. Now, last but not the least, what we also look at is in terms of, how are these costs maintained? I know you've probably seen in the news that every year the budget on NHS is rising. And, every year they talk about the NHS is underfunded and, NHS could collapse and things like that. So there's a strategic review which the Department of Health and the Secretary of State for the Health actually does. And this is done through committees. Now, this particular thing is done in order to ensure that the NHS is adequately funded. And when you look at that, sometimes they say there's a shortfall in funding, or, the funding is required. Then this is all or overspending in certain areas. For example, sometimes they say that, the public-private partnership which is happening within the NHS is actually draining NHS of the resources and the funds which need to be made available for frontline services. A&E department, when they say, is underfunded and understaffed. Now, those kind of things do come across, and there is a review which the Department of Health does every 3 years to see if the NHS is adequately funded and all the facilities which are required to provide these services are available. So in the last review, when they did, they kind of proposed a couple of things, like that the wait times for, patients to be seen at GP surgeries is increasing, the A&E wait times are increasing, and those are reviews which the government does from time to time to ensure that these services wherein, there is a delay or there's a lag are actually brought in line with the requirements which have been initially set in the, NHS Act. So here again, what we're saying is last year we were seeing that there's a gap of about 20 billion in terms of NHS funding. So the NHS budget for 2014-15 was about 150 billion or 120 billion pounds, which meant that as per the review which has been done under the 3-year cycle, they were saying that there's a shortfall or a gap of about 20 billion. So that is something which the government needs to look at funding, and it looks at savings or withdrawing, money from other projects and other areas to be able to fund, because this is one of the, basic services for which the funding has to be made available by the government, because this is, the National Health Service. And then there are lots of reforms which happen, as we see that it's a system which is one of the oldest kind of, health service anywhere in the world. It is undergoing change. So from time to time, they are also looking at innovations, reforms within the NHS, and these reforms are brought in through the route of introducing acts. So for example, when you looked at the Nhs Constitution, the National, when you look at the Healthcare Act, you look at the Health and Social Care Act of 2012, these are acts which are brought in so that reforms could be introduced in the Nhs Constitution, and reforms could be introduced within the system so that it continues to provide the kind of services which, obviously are required by patients and residents, and the NHS continues then to function in the way it has been set forth in the Nhs Constitution. And lastly, to conclude, what we look at is that when we look at the day-to-day working of the National Service, the government is also given a lot of freedom, or a lot of, free, after creating the acts and also the legislation, they have then allowed the CQC, the primary care trusts, and the other bodies to work independently to be able to ensure that the services which they are providing are provided adequately, and then they do reviews, and obviously they do reforms are introduced using the acts. So here the reforms which obviously they see which come up in the 3-year cycle when they are picked up are then kind of reviewed by the foundations and the NHS trust, and then they undergo further discussions and debates with the clinical commissioning groups, and at some stage when they are approved approved and they are approved in the form of an act, are then implemented within the NHS to ensure that there is a fuller reform which then provides the course correction required to be able to provide these services. So I'm going to kind of stop here, if that's okay. And what I'm going to do is obviously look at sending you a copy of this presentation, and also if you have any questions, then you can obviously raise and send that to me via email, and we can then look at them in a bit more detail if required. Okay. You okay with that, Naima?
Yeah. I was just reading. Okay. Thank you very much. Thank you, and see you.
That's fine. So what I'm going to do is obviously send this to you and send you a copy of a particular handout, so that you can read to kind of detail these slides that we've discussed today. Okay. And this handout will basically give you a better understanding in terms of how the provisioning is actually rolled out, from a point of view of looking at receiving the services at the end of the day from NHS.
Okay.
Is that okay? I've got two particular handouts that I'm going to send you. One is this one, which is on Moodle. Now this gives about this is a slightly older report, but 2015, it helps you give a bit of comparison of how provisioning of healthcare is done in various other countries, and it's a mix of different countries across Asia, Australia, we look at Europe, and obviously United States. And this is a very good report that you might also use for some bits and pieces of your assignment. Okay, this is one. And the other one that we have is something which I made a mention of, which is how is the policy created and how it is rolled out. This is a detailed document. You might not need to read all of that, but I think in terms of if you have the time and if you go through this in a bit more detail, this will give you the exact details of what is the healthcare, health and policy framework, how it works, how the government sets the agenda, how the implementation is done, how it benchmarks itself against world organizations when we look at the UN and the World Health Organization in particular. Okay, these two handouts would give you a detailed understanding, and would cover not just the topics but also help you in doing the assignment at a later stage.
Lovely.
Okay.
Yeah,
brilliant.
lovely.
Any questions, or if you have any doubts or any queries, please feel free to email. And my suggestion would be, because this is quite a large unit, if you start attempting, the LO1 that we've covered last week, and start to do a draft of reading that I'm sending you the handouts, but also along with that, start to do the draft of the task of LO3 would be good. Because this, when we cover, we will go quite quickly, but in terms of understanding, you might forget some of these things. And when you read the handouts, the idea would be to start to attempt the task so that you can pick up relevant material and then, put that in the assignment also.
Okay.
Okay?
Okay, lovely.
No worries, Naima.
Yeah.
Okay. Thanks a lot for joining the session today, and I will see you next week.
Thank you. See you. Take care. Bye-bye.
Bye.